Our guest on This is America and the World is the president-elect of the American Psychiatric Association, Dr. Vivian Pender. Dr. Pender is clinical professor of psychiatry at the Weill Cornell Medical College and training and supervising psychoanalyst at Columbia University. Dr. Pender, so good to be with you. Thanks for joining us.
Thank you so much. It's good to be here.
We're 8 months into the pandemic, just about now. As a country, if we were a collective client or patient, how are we doing?
Well, I think honestly, we're struggling. There is quite a bit of fear and worry. People feel fatigued and sometimes discombobulated. You know, they don't remember which day is which. Their schedules have been turned upside down. And the uncertainty of what's going to happen in the future is very stressful.
Mm-hmm. When you say fear, can you talk a little bit more about that?
Well, I think especially with this virus that, you know, can't be seen by the ordinary, what we say, the naked eye. And although we know that it's readily transmitted, it doesn't appear to a lot of people to be that terrible until they get it, or they know someone who gets sick. And then in many cases, as we know, we've had hundreds of thousands of deaths, that it can be extremely virulent. Mm-hmm. And so I think that the nature of the virus itself, and this is a novel virus, so we don't know that much about it. We're learning, and we know more and more every day, every week. And then also there's, in the midst of that, there's a lot of misinformation or information that isn't consistent. And I think that uncertainty about the future makes people very afraid.
Mm-hmm. Do people at a time like this, even if it's just in passing, regardless of age, think about their own mortality? What happens if I get COVID?
Well, I think a lot of young people feel sort of cavalier about the virus, and they may take unnecessary risks. But I think it is a time when a lot of people are kind of taking stock and thinking about what they've been doing, what's important to them, and I think it's older people that are thinking about their own mortality more than younger people.
Mm-hmm, mm-hmm. Is there, I'm flashing to some thoughts that I had to introduce into our conversation later on, but you've opened a door. And the door that you've opened, is this an opportunity, a time to take stock, as you have put on the table here? Is there something to be learned during this time about ourselves?
Absolutely, absolutely. I think that it is a time when, since it's not business as usual, and a lot of us are social distancing and staying home, it is a time when, a good time for people to think about what they've been doing before this pandemic, and evaluate in the new era, this new era that's coming, what is meaningful and what they want to do or not do if they can. I have spoken to a number of people who are thinking about things that they didn't do before, didn't want to risk, and now they're willing to take that risk.
You mentioned fear, you mentioned worry. and fatigue. And I had written down fatigue as something I wanted to take a run at with you. Fear and anger. It seems that I'm kind of running into people who have just, they're almost ready to snap. There is an anger at what we've been put through. Can you talk a little bit about the fatigue factor and the anger factor, if you're seeing some of that as well?
Sure. I think there is pandemic fatigue. A lot of us have a kind of cabin fever. We haven't been able to see some of our loved ones. We haven't had many of the connections or activities that we would usually do. So I think there are a lot of people who are so ready to get out, and that kind of makes them annoyed. I would say that if they're feeling very irritable and very down, then we should talk more about what that might mean for them.
So are you, what I hear what you're saying is that there are some kind of warning signs, and that maybe some reaching out and getting some professional help might be called for?
Yes, absolutely. So, I tell everyone to be mindful about themselves and kind of check in with themselves several times a day. How am I feeling, and how am I doing? Am I feeling so sad that about this whole situation, all the uncertainty, that I'm feeling so sad that I don't want to get out of bed. So I tell people to watch are they having difficulty with sleep or appetite or energy, or they're not getting the kind of joy that they used to get at usual times, or they're having difficulty in their relationships or at work, then and it's consistent, there's no let up for at least 2 weeks. So if it's every day for 2 weeks at least, and it just continues like that, then they should get a consultation, either with their primary care physician or a psychiatrist if one is available.
So something you just said, what I think is very important, is they could go to the primary care physician to discuss and maybe get a recommendation, huh?
Yes, absolutely. Absolutely. There are many medical conditions that can cause psychiatric symptoms. Neurological, endocrine, number of different things.
I was thinking as I was walking down to the studio today that the whole idea of wearing a mask, physical distancing, which is, I gather, a preferred term rather than social distancing, house arrest, as I call it, not being able to be comfortable to just simply shake hands with a person, give them a hug, a kiss if it's somebody that you know you're greeting, or where that's all permitted. This is not normal. This is a rough go, and this is a rough go that's going to keep on going.
Yes, these are not normal times. I mean, we're being hit with the pandemic, economic insecurity, racism, climate change. All at once. We're dealing with so much that this is not a normal time.
Realizing that it's not a normal time, and realizing these things. I mean, just walking into a building, and the first thing you're faced with is a stand that's offering you hand sanitizer. I mean, that's not the way we've lived for an entire lifetime. you could only wash your hands so many times a day. All of these things are kind of conspiring against us. And when we say it's not normal, but then you have laid out in some nice detail, yet sad detail, if these things continue, lack of sleep, not interested in eating, being irritable, so on and so forth, not wanting to get out of bed for a couple of weeks, then professional help is really called for. I was thinking when you also mentioned the economic crisis that we're in, so many people are hurting because they don't have enough money to pay rent or put food on their table. Help those folks, and help us who may know someone going through that pain. How can we help them?
Yeah. Well, actually, the American Psychiatric Association conducted a nationwide poll, found that 62% of Americans are more anxious than they were at the same time last year. And they cited COVID, economic insecurity, gun violence, and climate change as the overt burdens. But as far as people who are out of work and need to depend on food lines and things like that, people are struggling. I think that one of the things that I'm recommending to people who are fortunate enough to have resources is to reach out to people who don't have resources. It will make them feel better, and that kind of altruism, that generosity is very salutary for people. In both.
There's something that it sounds kind of trite, but it's something that I learned a long time ago, and it was those who bring sunshine into the lives of other people cannot keep it from themselves. There is something about doing something for somebody else that makes you feel good, huh?
Yes, it's actually, there have been studies that show that is the case. There's a part of the brain that is like the reward system, and doing something for someone else gives a person a feeling of reward. And the thing about the people who need something, the worst thing in the world is to feel like no one cares about them. They've been forgotten. They're having trouble, and they've been forgotten. So for someone to reach out to them, I think would go a long way.
I've gotten so involved in our conversation, Doctor, that I've gotten way behind in taking a little break, telling the folks that we're talking with the president-elect of the American Psychiatric Association, Dr. Vivian Pender, MD, a medical doctor as well. So we'll factor that into our conversation on the other side. So sit tight. This is America and the World. Underwriting for This is America and the World is made possible by the National Association for Children of Addiction, Faces and Voices of Recovery, the Forerunner Foundation, the Rotondaro Family Trust, the Sultanate of Oman, the Kingdom of Morocco, and the Embassy Series, Uniting People Through Musical Diplomacy. Doctor, in addition, you've also kind of mentioned racism, climate change. the amount of news that we are bombarded with on a daily basis is almost too much to handle. Plus the fact that people are wedded to their screens out of boredom, and they're being inundated with negative information over and over and over again. How do we police ourselves to know that that's having an impact on our stability, our sense of well-being, our calmness?
Yeah, I think that sometimes inadvertently the media tends to reinforce the worry and the anxiety and the negative images. And I tell people to turn off their TVs, put their phones down, turn off their social media, and just take a break, take a walk. Instead, you know, get out into the fresh air rather than watching the same thing again and again.
Mm-hmm. I want to talk a little bit about mental illness and mental health. And we'll start with mental illness. And I guess when you think of everything from addictions to schizophrenia, bipolar, a number of things that some of them we're just learning about, they're new names that come at us. Talking about mental illness in America, what percentage of families are impacted by someone in the family that has mental illness?
Well, in fact, the statistics show that 1 out of every 5 Americans will experience some kind of mental health problem in a year. So every year, 1 out of 5. It's really quite significant. I think that almost everyone must know someone then who is struggling with some sort of mental health problem. And 50% of people with diagnosed mental illness do not get treatment at all. 50% of people with mental illness do not get treatment.
So
and that's a tragedy.
So if 1 out of 5 people, 1 out of 5 people are struggling with some sense of mental illness during the course of the year, and then 50% of the people who are struggling are getting no help, where does that leave a family to deal with this? How do we?
I think it's not a good situation in the United States, where there's stigma, there's bias, there's inaccessibility to healthcare, so that there are all of these factors that don't allow or they interfere with the ability to get help. So people struggle quite a bit, and it not only affects themselves, it affects their families, their friends, their coworkers. It affects the whole community that they live in.
When I was thinking about mental illness, I wrote down everything from schizophrenia to autism. Would that be in there as well? There's bipolar, manic depression, addictions. How much of these serious mental illnesses are psychological, biological, physiological? And I'm not sure if I'm using all the words correctly. But you're an MD, a medical doctor. Talk a little bit about whether it's psychological or physiological.
Well, there are many mental illnesses that we believe are biological. That is, a person is born with a predisposition to developing a mental illness, and sometimes there's some critical event that triggers the illness to become full blown. And we don't, and of course there's this nature nurture argument that you're pointing out. We don't know exactly how much is one or the other, but we do know definitely that there are mental illnesses that we can look at neuroimaging, like functional MRI, or a genetic pathway in a family history, and determine that there might be a biomarker that we can find in the future. So, that said, the environment always has an impact on people, positive and negative. And if someone, let's say, has autism and it's not diagnosed, and then they're treated as if they're, an outcast, they're ostracized, they're called names, they're bullied, then that environment is going to affect them for sometimes their whole lives.
So you mentioned the possibility of a genetic predisposition to the mental illness, but you also used the word that there might be some kind of trauma that could exacerbate and bring it to the forefront. What would be an example of that trauma?
It could be something like a death in the family of let's say a parent, or even a divorce, or a medical illness in the person. Sometimes I've seen some patients who had a car accident, and it was after the car accident that they became more kind of floridly ill.
Mm-hmm. When we were talking a little bit about looking at ourselves and self-care, and knowing that if we experience some symptoms over the course of a couple of weeks, that we should reach out for ourselves, how about someone who's in a family where there may be some of these very serious illnesses that border in or are under the heading of mental illness, that they should be reaching out? Are there some questions that could be asked, or some behaviors that could be observed that would cause people to say, if 50% of mental illness is not being treated, what can you offer us as kind of a guideline as to this demands serious treatment right now?
Yeah. Well, we do know that a certain percentage of mental illness can be diagnosed early in life, let's say age 7 to 14, that a lot of mental illness symptoms will show up early. And the best I can say is that early intervention, early diagnosis and early intervention is critical in sometimes preventing further symptoms from developing.
Mm-hmm.
So I would say for people to be educated, to know what the early warning signs are. I think as far as autism, there's a lot of emphasis now on very early diagnosis, like age 2, 3, and then there are certain treatments that can be put in place, and with the hope that further development will be mitigated at least. So I would ask people to be educated and to be to take note. Don't dismiss a child who is complaining about something, or who doesn't seem to be able to concentrate, or a child who seems to be unruly, misbehaving, or throwing a tantrum. Those things should be at least thought about.
If you are in crisis or know someone who is, these resources offer immediate help. For information about This Is America and the World, visit our website, thisisamericatv.net, or our YouTube channel, This Is America TV, and follow us on Facebook and Twitter. Underwriting for This Is America and the World is made possible by the National Association for Children of Addiction, Faces and Voices of Recovery, the Forerunner Foundation, the Rotondaro Family Trust, the Sultanate of Oman, the Kingdom of Morocco, and the Embassy Series, Uniting People Through Musical Diplomacy.